Alrighty. Assalamu alaikum. I hope you all are doing well. Let's do some past papers together. Next question is high levels of serum progesterone during pregnancy are secreted by which structure? So when it says during pregnancy, that means it's referring to it's not referring to corpusodium. So corpusodium is like at the start of pregnancy and before pregnancy, while during pregnancy, the main source is the placenta. Okay. A doctor, after a thorough examination, diagnosed the patient with benign prostatic hyperplasia. He gives him five alpha reductase inhibitor to decrease which of the following. So, क्या होता है कि dihydrotestosterone is the main contributor to the growth of the prostate gland, right? तो उसके लिए एक एंजाइम चाहिए होता है टेस्टोस्टेरोन से डायरोटेस्टोस्टेरोन जाने में 5 alpha reductase चाहिए होता है. So of course, when you give an inhibitor, that step will not happen. Testosterone will remain as testosterone. It will not convert into dihydrotestosterone. So you need to find that option, which is the fourth one. What is the meaning of empowerment? Uh, we are women. We are free. We are that kind of thing, right? So that song from GTA that talked about how women they would deserve to be empowered. Um, so that's basically having control over one's own life. So and that's a very vague statement that can mean a lot of things, but yeah, in this context, it is the ability to take decisions and actions, by their own for their own self, which is interesting. Anyhow, ovarian stroma is chiefly composed of which of the following? Um, so ovarian stroma, I think it's probably, like that's a very good question. Either it's vascular sinusoids, right? So, or they are spindle shaped cells. It could be anything. I think it's spindle shaped cells. Yeah. So, क्या है कि fibroblast type cells होते हैं, spindle shaped squamous. I'm sure that's the thing. Arranged in whorls and supporting developing follicles. And yeah, fair enough. Primi gravida has a 12. So now what does primi gravida mean? That's a good question. Primi gravida. Primi gravida, a woman who is pregnant for the first time. Okay, mate. So, 12-week gestation has complaints of amenorrhea. Presented for her antenatal checkup, the doctor is unable to detect a fetal heartbeat, which is the diagnosis. So, this is of course a missed abortion. They had no clue it happened, right? It occurs when the embryo or fetus dies in utero, but the products of conceptions are not expelled. So, you know, they have those symptoms. They have, amenorrhea. They have pregnancy symptoms, but sadly, there is no fetus growing, right? So that's quite sad. Um, Extremely painful, I'm sure. So, which of the following is the most common cause of puerperal pelvic inflammatory disease? So, puerperal basically means, um, you know, it's like after delivery, right? That's what puerperal means, if I'm not wrong. So, puerperal means during or relating the period of about 6 weeks after childbirth. So, उस वक्त ना देखो जैसे delivery होती है, there's like a lot of infections going around. It's very possible that it's a polybacterial infection, right? Um, Postpartum uterus is exposed to multiple organisms 100%, so it's polymicrobial. Next question. Let's have a look at it. 19-year-old woman whose first menstrual period started 5 years ago, visiting her physician for several years. Last year, she was diagnosed with oligomenorrhea. In the past month, she has got hirsutism, and has gained 10 kilograms of weight. On ultrasound, there are no significant abdominal findings, but the pelvis shows twice the size of the ovaries. What is her diagnosis? ठीक है सही है तो this is clearly polycystic ovarian disease. Why? First of all, oligomenorrhea सही है, hirsutism सही है, weight gain ठीक है, pelvis twice the size of the ovaries. Now, what does that? All of this is PCOS. Basically, क्या हो रहा है? Androgens ज़्यादा हैं, androgens ज़्यादा हैं, तो of course, male-like symptoms, which is hirsutism. There's just so many things that point to it. So, hyperandrogenism, hirsutism, acne, and sometimes male pattern hair loss, oligo or anovulation lead to irregular and absent menstrual cycle and polycystic ovaries. Fair enough, right? LH ज़्यादा है, तो एक्सेस एंड्रोजन प्रोडक्शन हो रही है, एंड्रोजन की वजह से एस्ट्रोजन कम है, एस्ट्रोजन सॉरी ज़्यादा है, एस्ट्रोजन ज़्यादा है तो ऑफ कोर्स with that thing, you have many more problems that are associated with all of these symptoms. Which of the following is the suitable differential diagnosis for pervaginal blood? That's a interesting question. Um, so pervaginal blood. So per basically means below, right? So I think that of course basically means vesicovaginal fistula, right? That occurs after delivery or the perforation of bladder and vagina. I think it's the fifth one. Yeah. So per vaginal bleeding. I think we need to understand what this is. Fistula is a normal communication between the urinary bladder and vagina. Most commonly occurring is a complication of prolonged obstructive labor or post-surgical trauma. However, this condition characteristically causes continuous leakage of urine through the vagina, not blood. Interesting. Let's add an image for this. Report this. Add an image. Say, I'll add an image. No doubt about it. सही है अगले सवाल की तरफ चलते हैं. I understand this can be a bit difficult to visualize, right? But it's okay. Which of the following structure produces inhibin? So inhibin basically is that hormone which inhibits FSH, right? तो कौन बनाते हैं इसे बनाते हैं Sertoli cells. Remember that inhibin is a glycoprotein hormone secreted by the Sertoli cells, and of course the negative feedback is for FSH, right? Fair enough. So this regulation ensures that spermatogenesis remains balanced, and yeah, it's good stuff. It's really good stuff. Sertoli cells और क्या रिलीज करते हैं? एंड्रोजन बाइंडिंग प्रोटीन भी रिलीज करते हैं. ठीक है. अच्छा, ब्लड टेस्ट बैरियर के बारे में मोस्ट इनअप्रोप्रिएट स्टेटमेंट बतानी है. Sertoli cells बनाते हैं 100%. Basal compartment of the seminiferous tubule, maybe that's true. Contact or lateral process, yes. Prevent autoimmune reaction, yes. So the which is inappropriate. Which is inappropriate. Um, yeah, luminal department में नहीं होता. It is in the basal department, right? So it is in the basal part, right? So that makes sense. ठीक है. All right. सही है. So इसे हम report कर देते हैं to add an image ताकि it makes it better to visualize this specific concept of the basement membrane being in that place. Right. Next question: which stage of pregnancy are women most prone to get anemia? So this is when the hematocrit that blood volume is the lowest. So that's the 7th month, right? So क्या हो रहा है कि बहुत ज़्यादा डिमांड है, एनीमिया हो रहा है क्योंकि प्लाज्मा वॉल्यूम मैक्सिमम है, एरिथ्रोपोइसिस उस हिसाब से नहीं हो रही, and that can cause problems, right? Fair enough. Next question. Deficiency of iodine in maternal blood can cause which condition in a child? So of course, iodine की कमी hypothyroidism हो जाता है. This is and then the current question, but you get the gist of it, right? Mechanism क्या है? Mechanism ये है कि thyroid gland की functioning के लिए iodine की ज़रूरत है, right? अगर iodine नहीं है, your um, thyroid gland cannot function, right? So fair enough. Most common symptom of endometrial hyperplasia. Endometrial hyperplasia. Endometrial hyperplasia ki I think most common symptom would be I think discharge. Not sure. Yeah, I think it's discharge or pain. Maybe pain. Yeah, pain. Say so vaginal bleeding is like the main thinking of endometrium होती है. ठीक है, got it. Okay. Most prominent and can be used to identify fallopian tubes. Uterine tubes की जो जहाँ तक बात है, pseudo-certified columnar epithelium, yes or no? I don't think so. Musk has 3 layers. No, I don't think so. Highly branched mucosal longitudinal folds. Hmm. I think this is it. Yeah. So mucosa is lined by simple serrated columnar epithelium with pec cells. These folds are branched and longitudinal. ठीक हो गया. Okay. Which of the following is an estrogen oral contraceptive? Oh my word. So, estrogen oral contraceptive. So, I think it's mestranol. I am, I think it is mestranol. I might be wrong. Okay, it is mestranol. Synthetic estrogen used in combination of oral contraceptives. Mechanism of action क्या है कि वो जी गोनाडोट्रोपिन की रिलीज कम कर देगा तो ओव्यूलेशन नहीं होगी ठीक है तो it's awesome right in that sense prodrug है liver to ethinyl estradiol right so it contains active estrogen typically used in combination with progesterone and oral contraceptive pills ठीक है okay set which of the following set defines the factors that affect empowerment people no people resources no nature natural disasters no people resources and events all three things combined. In which of the following is endocrine therapy used as a palliative treatment? So, of course, palliative means like end of life, like really just to ease the pain. That's endometrial. Carcinoma, no, that's not it. That it can get better. But metastatic breast cancer is something that is, you know, there's like a very difficult chance of survival. So, yeah. Which of the following are the most common problems related to sexual dysfunction in males? Yeah, it's there. It's a problem, right? So erectile dysfunction, yes, and loss of sexual interest, yes. So it's like very subjective, I think. No, it's not. It's very clear. Um, if you have erectile dysfunction, that's a problem. Early ejaculation, premature ejaculation is a problem. Loss of interest, that's a insane problem. So I think this is the best answer. All three together are the most frequent problems encountered. That is very true. And yeah. Okay, which of the following is odd regarding Graafian follicles? Hmm. Zona pellucida, yes. Lico, primary oocyte. Mm-hmm. I wonder what it's asking. The primary oocyte. Hmm. That's it, right? Yeah. So Graafian follicles secondary oocyte होता है, primary नहीं होता. अच्छा, when should IUDs be implanted? Interesting. I think during menstruation. इसका वो क्या है कि cervix naturally dilated है सही है woman pregnant नहीं है और it can basically be very safe and comforting. Which of the following describe a finasteride? Finasteride वही अभी हमने पहले क्वेश्चन देखा उसके ऊपर था कि बिनाइल प्रोस्टेटिक हाइपरप्लेजिया में एक एंजाइम इस्तेमाल होता है 5 अल्फा रिडक्टेज राइट वो टेस्टोस्टेरोन को डाईहाइड्रोटेस्टोस्टेरोन में कन्वर्ट करता है. Finasteride is basically the inhibitor for that specific enzyme. So of course हमारा जो fifth option that's the best one, right? Comparative inhibitor for the enzyme 5 alpha reductase. ठीक हो गया. अच्छा, which of these increases perception of cervical mucus to the sperm movement? That is your prostaglandins, right? Very, very cool things. They basically help, in contraction. They help in making the cervical mucus permeable and receptive, and it's like a nice wingman for the sperm, right? Fair enough. Okay. Which of the following is the precursor of progesterone? Of course, that is pregnenolone. Which of the following is not true about the Cowper's gland? Acha ji. Epithelium is made of serous tall columnar cells. Yes. They are paired. Yes. They are smooth muscles in septa form lobules. Yes. They're tubulo-alveolar. 100%. Their ducts open into membranous urethra. No. They open in the spongy urethra. What the hell? Well, question क्या? Not true. Hmm. Oh, wow. I need to get this rechecked. I need to get this rechecked because it definitely does feel a bit odd. Yeah. Yeah. Um, Cowper's gland, epithelium, and where do they go? Um, that is a very so it is so yeah, it is mucus secreting and they open into the spongy urethra. So yeah, that's actually दो statement गलत है इसमें ना because they open into the spongy urethra, not the membranous urethra. हम्म और ये भी गलत है सही है fair enough awesome okay ठीक हो गया अच्छा which of the following hormones can decrease the reception of sperm decrease the reception of sperm that's a very interesting question decrease the reception um I think it would it be HCG? I mean, I don't understand. Which hormone dominates after ovulation is responsible for making the cervical? Ah, okay. That's progesterone, right? So, yeah, estrogen enhances the reception, but progesterone decreases sperm reception by making the cervical mucus thick and viscous, forming a barrier that impedes sperm entry. Fair enough. Awesome. Okay. Which of the following is not true about the myometrium? Myometrium is a thick muscular layer, right? Main function is to induce uterine contraction, 100% sensitive to oxytocin. That I'm not sure about. Undergoes hyperplasia hypertrophy. No, May- maybe it does. Maybe it does. It does. S- Wow, I don't know. Hmm. Think about which term in the option describes a layer of the uterus that actually part of the lining, not the muscle wall. Hmm. Is it this? Oh, okay. Hmm. Hey, fair enough. My bad. The following is not true about the oviduct. Plexus ciliated, intermural portion extends through the uterine wall. Muscle layer consists of an outer longitudinal inner circular layer. Integrates as non-functional. Proximal part is called isthmus. Wow, I've got no idea, mate. Not true. अच्छा देखो पहला तो सही है तीसरा भी सही है पांचवा भी सही है Hmm. Yeah, maybe it's like the fifth one, right? Which plays a secret role, the more tired role. Yeah, it's definitely fifth. Set. Perfect. Which of the following is not a cause of cryptorchidism? Cryptorchidism की cause नहीं है. Okay. Um, I'm sure benign prostatic hyperplasia is not a cause. Main function of the testis, production of sperm and testosterone, no doubt about it. Protective effect. अच्छा estrogen का एक है protective effect क्योंकि वो HDL ज़्यादा कर देता है, right? Increases HDL, it reduces LDL, promotes vasodilation, helps maintain vascular elasticity. It's amazing. Pelvic inflammatory disease. What does the gonococcal infection affect? Hmm. PID के अंदर देखो आपका जो क्या नाम है यूट्रस होता है ना आई थिंक वो अफेक्ट होता है आई थिंक um or uterine tubes. Yeah, the uterine tubes are affected. Sorry. Which of the following is not required for fertilization? These are the cholesterol from seminal vesicles. Which of the following does the fertilization most commonly occur in? I think I'm done. I don't think I should stream.